Oxygen is our body's most essential fuel. Every cell, organ, and tissue in our body depends on a continuous, adequate supply of oxygen. When oxygen supply drops, our body responds with a series of warning signs and symptoms, and this condition is called hypoxia. Early warning signs of hypoxia. In mild cases of hypoxia, our body tries to compensate for it by working harder to move oxygen through the bloodstream. Early signs are often simple and may feel like ordinary fatigue or stress. You may experience shortness of breath during physical activity, with faster or deeper breathing than usual. The heart rate may also increase, and symptoms like headache and difficulty concentrating can occur. For some individuals, it may also appear as feeling restless or have unexplained anxiety. Moderate symptoms of hypoxia. As oxygen levels continue to drop further, our body's ability to compensate begins to weaken, and symptoms start to appear that are more noticeable and difficult to ignore. You may develop cyanosis, which is a bluish tint to the lips, fingertips, or skin. Other signs such as dizziness or lightheadedness, chest tightness or pain, and increasing fatigue with muscle weakness may also appear. Coordination may become poor and judgment can be impaired, making it harder to think clearly or respond appropriately. Severe symptoms of hypoxia. Severe hypoxia is a medical emergency, as it may cause permanent damage to the brain and other vital organs. So immediate medical attention is required. Symptoms like severe confusion or disorientation, extreme breathlessness even at rest, and gray or very pale skin may appear. Breathing may become either very rapid or unusually slow, and in serious cases, the person may lose consciousness. Emergency. Call emergency services immediately if you observe bluish skin, severe breathing difficulty, sudden confusion, or loss of consciousness. These are the signs shown by our body of critical oxygen deprivation requiring urgent care. Common causes of hypoxia. Low blood oxygen can arise from many underlying conditions like asthma, pneumonia, chronic obstructive pulmonary disease, COPD, heart failure, severe anemia, high-altitude exposure, and obstructive sleep apnea. The root problem is the same, that is, oxygen cannot reach the bloodstream in sufficient quantities, whether due to a blocked airway, damaged lung tissue, impaired circulation, or a low oxygen environment. How to measure oxygen levels. A small clip-on device called pulse oximeter that is worn on the fingertip is used to measure oxygen saturation levels at home. A normal reading is between 95% and 100%. Readings below 90% are considered medically significant and may need prompt evaluation by a healthcare professional. When to seek help. After strenuous exercise, mild breathlessness is normal, but persistent shortness of breath, unexplained rapid heart rate, or any visible cyanosis requires a prompt visit to a doctor. Like, share, and subscribe for more health-related contents like this. Thank you for watching.